I'll be demonstrating IM injections. So of course you need to grab your MAR and make sure that it's the correct patient. Make sure your medication's due. I have morphine 1 to 2 milligrams IM every 6 hours. I'm going to make sure that it's the appropriate time to give it, and it's the correct patient, correct medication, doing all of my checks. I'm going to then go to my patient and introduce myself and perform AIDIT. Say, Mr. Smith, my name is Erin. I'm going to be your nursing student today. I'm going to be giving you your morphine injection, as you said you were having some pain. Could you rate your pain on a scale from 0 to 10 for me? Patient would rate their pain depending on whatever their score is. Pain is subjective, so it's whatever your patient says. They rate their pain at about a 6, so I'm going to go ahead and give them 1 milligram of morphine. I'm going to go ahead and check my MAR. When I do that, I'm going to let them know I'm going to get your morphine ready. It takes about 5 minutes or so, and you will feel a little bit of discomfort when I go ahead and do this injection. Do you have any questions? No? Alright, I'm going to go ahead and step out and get your medication ready. Because they rated their pain at a 6, I'm going to give them 1 milligram. Typically when you have morphine, which is IM, it'll be rated for, it'll be a scale, 1 to 2. If their pain was a 7 or higher, I would give them 2 milligrams. If their pain is a 6 and lower, I would give them just 1 milligram, depending on what their pain is. If their patient has been consistently getting 2 milligrams for their pain, even though they've been rating it anywhere from 4 to 6 to 7, 9, then I would go ahead and give them the 2. But because they rated their pain a 6, and they've been giving it 1 or 2, depending on what their score is, I'm just going to give them the 1 milligram. Make sure, I'm going to do my check again. So I have morphine, 2 milligrams per mil. My MAR says I need 1 milligram or 2 milligrams, and I'm going to give 1. So I've got my medication, I've got my MAR, I've got the correct needle. So what I need is a 3 cc syringe with a 25 gauge, 1 inch needle. It's going to look very similar to a sub-Q needle, but you're going to need the longer one to make sure we get down to our muscle. We have 5 spots for our IM injections. We have our deltoid, we have our vastus lateralis and our rectal femoris, we have our dorsal gluteal, and we have our, I think it's ventral gluteal, but we don't use our dorsal gluteal anymore. There's too high of a risk of hitting the nerve that runs there. So most commonly you're going to use your deltoid and your vastus lateralis, just depending on how much medication you are actually giving, as those sites will hold different amounts of medication, which you'll go over in math and meds. Alright, so I'm going to check my MAR again, making sure I have the right medication, it's the right time, get everything ready, all my supplies ready. I'm going to go ahead and wash my hands and put on gloves. Since it is a small dose, I like their deltoid, so I'm going to position my patient in a sitting up position that's comfortable for them and easy for me to get to them. So I would have them sitting up. Semi-Fowlers, high-Fowlers would be fine, and I would put the bed rail down to make sure that I'm not leaning over and it's not going to be in the way. When you do IM, you typically may see someone do the Z-track method, which is simply where you're going to pull the tissue over the top of the muscle, inject your syringe, and then give the medication and lock it back in place so that the medication can't come out with the needle. But we're going to go ahead and get everything drawn up first. So I'm going to, clean the top of my vial with an alcohol swab, open my syringe. Now I want to give 1 milligram, and my vial says 2 milligrams per 1 mil. So that means I'm going to give half a milliliter to give the 1 mil of morphine that I would like to give. I'm going to then inject air. I'm going to draw up. Morphine is also a controlled substance, so you should have to do a 2-nurse check with your morphine. So I would show my nurse that I have that I'm going to give 1 mil, and it is 2 mils. I'm going to then do the scoop method to put the cap back on my needle and get ready. So my patient is positioned and ready to go. I'm going to clean their shoulder. So I'm going to find the tip of their shoulder and go down. I would go down about 2 fingers and make a V like so. So then I've found where the position of where my landmarks are. I'm going to do my Z-track, so I'm going to slide up. I'm going to uncap my needle first. I'm going to slide the tissues up, and I'm going to go straight in at a 90-degree angle, and you're going in like a dart. Straight in, let your patient know what you're doing before. So on the count of 3, I'm going to inject your medication. And then I'm going to go ahead and give the medication, release, and pull the needle out and activate my safety. I'll blot if there's any blood, and I can put a Band-Aid there if needed. You need to make sure you're going to go in like a dart. Don't go in slow. It's not very nice to your patients. If in fact you have a smaller patient, you may need to use a shorter needle just so we don't hit bone. But most commonly you're going to use the 1-inch needle. And then make sure that when you're done, you clean up your supplies, tuck your patient back in, thank them. Make sure you put everything that's in the sharps container that would be correct. And then you need to come back in 30 minutes and make sure that your patient's pain has improved. If not, then we need to go back and look at MR and see what else we have available for their pain. Oral medication, you can do 45 minutes to 60 minutes, but since this is IM, you're going to do 30 minutes to 45 minutes to make sure that the pain medication has worked.